Hi, Dr. Matthew Weiner here to talk to you about weight loss after bariatric surgery, specifically addressing the question I get from pretty much every bariatric surgery patient who comes to see me, which is, Dr. Weiner, how much weight do you think I'm going to lose? And I'm here to help you answer that question and figure out the importance of knowing the answer and some other things that you probably didn't know about what determines weight loss after surgery, so that you can proceed through your weight loss journey with some better information and better understanding of how these procedures actually work. So the question always starts with, Dr. Weiner, what should be my goal weight? And people rarely ask me this at their first visit, but as we're getting closer to surgery, that question almost always comes up. So I'm gonna talk to you about how difficult it is to really answer that question. And in the end, I'm going to show you how it's probably not even important that we do. So to start, the reason that it's so difficult is that weight loss is highly variable at 1 year after surgery. And I will tell you, I see this in my practice day in and day out. I put all of my patients on our Pound of Cure nutritional program, and I will tell you that my patients tend to be extremely compliant, very dedicated. We're clear in explaining the expectations after surgery. We do a lot and put a ton of effort into counseling our patients on our nutritional program so that, as I tell them, when you get wheeled down that hospital hallway toward the operating room and you're watching the lights go by, that if I was to ask you, are you certain about what it's going to take to succeed lifelong after surgery? You can answer with a clear yes, that you understand good nutrition, you understand the plan. And that, to me, if you can't answer that question as you're going down that hallway, then it might be time to stop the stretcher. So weight loss after 1 year is highly variable. And when we see these patients who are super compliant, we may see that they fall on the lower side of the weight loss spectrum. It's entirely possible to be 100% compliant, to follow everything that we talk about, to follow every rule and lose less weight than average. And the misconception that we have, particularly at 1 year, is that success after surgery is completely dependent on how compliant you are. What we also see is this group way to the right, who I refer to as super responders. These are people where the weight loss is effortless, where they go almost all the way down, sometimes all the way down to their ideal body weight. These are my post-bariatric patients who are wearing a size 2 or a size 4 dress, and I have some of these patients in my practice. And in fact, success for them comes very easily. They reach a fantastic weight, reverse their health, and really have a tremendous response. There's a subset of patients who just respond better than everybody else to surgery. But this has been shown time and time again, study after study, technique after technique, hospital to hospital, country to country, that there is weight loss variability after surgery and that compliance is not always the primary determinant of this. So a lot of people are going to say, you know, this sounds crazy from you, Dr. Weiner. You've put all this time and energy into this preoperative counseling program. What's the point of it if you're telling me that it's already predetermined and that it doesn't have to do with compliance? And just hold your horses. I'm going to get there, I promise. So what we find is that there are some clinical predictors of weight loss after surgery. We find that if you're younger, you'll lose more weight than if you're older. We find that if you have diabetes, you actually lose less weight than if you don't have diabetes going into surgery. If you are physically active, if you're able to exercise, if you move around a lot as part of your job, you'll typically lose more weight than if you don't. If you are an African American, on average, you'll lose a little bit less weight than if you're non-African American. If you have bipolar disorder, we see less weight loss. These are all things that have been teased out in the literature as we look at success after surgery. We find that patients with bipolar disorder, on average, lose less weight than those who don't have bipolar disorder. My personal belief is that almost every medication used to treat bipolar disorder causes weight gain, and that this is probably more an impact of the medication these patients are taking rather than something inherent in their brain. But that hasn't been fully worked out. When I have bipolar patients in my practice, and I do have quite a few, we work a lot with the psychiatrist to try to minimize the weight gaining effects of the medication regimen that they're taking before we proceed with surgery. And believe it or not, smoking is actually a positive predictor for weight loss. If you smoke, you lose more weight. The reason for that, as I've talked about in some of my other videos, is that smoking makes you miserable after surgery. It makes eating a painful experience. And we also know that nicotine is a set point lowering agent. And because of that, it'll cause some additional weight loss. Now again, I am not telling you to smoke after surgery. In fact, I've told you many times before, if you do, you will be miserable. However, it is associated with more weight loss statistically. But without question, the best predictor of early success after weight loss surgery is your genetics. And there have been some really great studies that have figured out that if you have a first-degree relative who's had bariatric surgery, the chances are your weight loss will be very similar to theirs. And now we're even going further, and a gene has been isolated, which can be used to predict success after surgery. Now, unfortunately, the test for this gene is not commercially available, so I can't order it on my patients. But the second I can, believe me, I will, because this is an incredibly powerful tool. If we can pick out these super responders and try to encourage them to have surgery, then we can get better results than we are right now. For you as an individual, your genetics are what your genetics are, and it can't be changed. But there's a lot of activity in this. If I have one question I can ask a patient to try to determine whether or not they're going to be successful after surgery, the question I would ask is, do you have a first-degree relative, a sibling, brother or sister, a parent or a child who has had bariatric surgery? And if so, how well they do after surgery? And if you tell me, I have a sister who had it and she did great, she's 10 years out and she's still 120 pounds down, to me, I would be able to say to you, well, this really speaks very highly of your chances of success after surgery. And so of all the questions I can ask, that for me, especially at 1 year, is the most important predictor. But when we start to look a little closer, because for me, bariatric surgery is not about the first year. The first year is magical. It's easy. The weight comes off. The ability to comply with the postoperative diet is pretty easy because of your anatomy. But when we look at this 3 years later, we actually find that this bell curve has spread. And in fact, we see a wider variation. First of all, we see a drop from around 65% down to 55%. So there is absolutely a little bit of weight regain after surgery. And what we see is we have more patients who are spread further out. So where we were a little bit more tightly coupled in the previous graph, there's more variability, more variation after surgery. So the question is, why is weight loss variable? I've already talked to you about genes, and the other obvious component is environment. And success after weight loss surgery is no different than weight loss from dieting and then weight loss from medications. And when, and again, I don't use Adipex or Topamax or any of these new medications for weight loss because they just, to me, don't show enough long-term benefit. They're very expensive, and some of them can't be continued for life. So we really don't use them. But if there was a medication out there that really showed good results and a long-term safety profile, I would be happy to use it. I'll use any trick we can come up with. But when we look at medications, when we look at response to dieting, we see tremendous variability. And bariatric surgery is no different. There's clearly the genetic component, and we all know this. You know someone who can go on a diet and drop 10 pounds in a week without even trying. And then for you to lose 10 pounds, it's going to take you 2 months of being absolutely perfectly compliant with a very rigorous nutritional program. So we know there's variation up front. What we also see is there's variation after surgery. And it's partly genetic, partly based on your environment, your food intake, but also the pills you take, the stress in your life, the way you sleep, your level of physical activity. There's many other factors that determine this beyond just the food that you take in. And when we see this interaction, this intersection, this is where weight loss occurs. So it's because my individual patients, as they come to me, they have variable genetics. They have a differing environment. One may be a postal worker and walks 10 miles a day. The other may be a sedentary office worker who walks, at most a quarter or a half a mile a day. And their environments are different, the genetics are different, and so we're going to see different results after surgery. But in my opinion, this is what's happening. In the first year, when we're tightly coupled, and the science is very clear on weight loss after year 1, compliance doesn't have much to do with it. If you follow the Pound to Cure plan perfectly at 1 year, versus if you barely follow it at all and more or less go back to your old eating habits, that has very little impact on how much weight you lose at 1 year. But again, we are not looking at success at 1 year. We're looking at success at 5 years, at 10 years, at 20 years, for the rest of your life. But genetics is the primary driver of success at 1 year, without question. There's something going on with the way your body responds and loses weight as we alter your anatomy, either through a sleeve gastrectomy or a gastric bypass. When we look at year 3, though, we start to find, as we see that increased variability, what we see is the environment starts to come into play. And so now we start to, although the genetics still plays a very important role, and it will for the rest of your life, and that super responder group tends to have a very low bar or low threshold that they need to maintain in order to maintain their weight loss. But we see that the environment starts playing a bigger role. The choices that you make about food, your physical activity, avoiding medications that cause weight gain, avoiding stress or learning how to manage stress in your life through exercise or even meditation, whatever you can come up with. We find that environmental factor starts to play a larger role. And when I'm working with my patients preoperatively, 6 months before surgery, when we're working in that first year, making sure that they're developing the healthy habits that they're going to be able to maintain for life, getting them on an exercise program, really committing them to health and fitness, we're trying to optimize their environment. Again, it doesn't impact things in that first year. It's going to have the impact at 3 years, at 5 years, at 10 years. This is an investment in the longevity of your weight loss. And when we look at year 10, we start to see that the environmental component plays a very, very significant role. In fact, probably the driving and most important and determinant role in your overall weight loss. So even that group of super responders, if they go back to eating fast food on a regular basis, to drinking soda pop, to eating dessert with every meal, and to eating a diet that consists primarily of processed foods, we will see weight regain without question. However, even if you're not a genetic super responder, but you're following the Pound to Cure plan, you're exercising, and you're avoiding medications that cause weight loss, you're managing your stress, then you'll be able to maintain that weight loss. And when we look at the scale, 10 years down the road, if the genetics are good, but the environment is poor, you're going to weigh more. You're going to have to experience more weight regain than someone whose genetics are poor, but environment is pure. So, to get back to what's my goal weight, I'm going to do a little bit of math here. So, when people ask me this question, I start with the 65% on average weight loss at 1 year. So, we'll do the math, but I'm going to get to, I have an important point to make here. So let's take a patient who's 280 pounds, and let's say she's 5 foot 6 inches. So the 65% excess weight loss means that of all the weight you have to lose, you'll lose 65% of it. So you don't lose all the way down to a normal weight on average. You lose around 65%, or roughly 2/3 of the weight you have. So someone who's 5 foot 6, and let's say it's a female, the formula for ideal body weight, and there are several, but the simplest one is that for a female it's 100 pounds for the first 5 feet, and then 5 pounds for every inch over 5 feet. So that would be 100 pounds plus 6 times 5. 6 inches times 5 pounds, which will give us 130 pounds. So if you're 5 foot 6, your ideal body weight is 130 pounds. If you're starting at 280, that means that the total amount of weight you have to lose is 280 minus 130, which is 150 pounds. Times 2/3 equals 100 pounds. So on average, someone who's 280 pounds, 5 foot 6, at 1 year will lose 100 pounds and finish with a weight of 180 pounds. But the truth is, this calculation is totally unimportant. Because again, at 1 year, your genetics are going to drive this. And I will tell you, whether you're 180 pounds, 200 pounds, 150 pounds, having worked through this with lots of patients at this point, this number ceases to bring you happiness after a year or two. And in the end, success means that you develop a healthy relationship with food and with your body. When you're able to look in the mirror and say, I work hard to maintain my health. I like the way my body looks. I like to sit down and enjoy a meal where I don't feel guilty afterward, where I'm able to control my cravings and my hunger. And I enjoy unprocessed foods. I have a very clear understanding of what it takes for me to maintain my weight loss and maintain my overall health. And I enjoy physical activity. And this is a source of pleasure for me, and it's important. And I'm not going to do anything to jeopardize it. When you can look in the mirror and you can sit down at the table and like what you see and feel good after what you eat, you've achieved success. And this must be our goal, because in the end, it's about your happiness. And this, more than whether you're 150, 180, or 200 pounds, will determine your overall happiness and success after surgery. Thanks for your attention. If you're in southeastern Michigan and you would like to see me, you can visit my website at www.drmatthewweiner.com or call the phone number listed here. You can pick up a copy of my book, A Pound of Cure, on Amazon. You can subscribe to my YouTube channel. We've got a lot of other videos. Look at our Facebook page at A Pound of Cure. Thank you.